Then we're going to dive into some initial material. My name is Nathaniel Osgood. It's my great privilege and pleasure to be with you this week as your instructor for this course. In the course of the next 4 days, we're going to be exploring the application of methods variously known as system science methods or complex systems methods to health, and particularly to the issue of dealing with the burden of chronic disease and ameliorating that burden over the life course, taking into account the service interactions associated with that health burden. So take into account the fact that much of the burden of chronic disease falls on the healthcare system, and the ability of the healthcare system to deliver adequate care in turn is reflected in the health of the population. So there's this reciprocal causality linking those two systems that will be at the heart of some of our examples, some of our discussion, our analytic lenses that we use this week. Within the course of the week, I am hoping to introduce you to several complex systems methods, system science methods, with a particularly strong emphasis on one of them, to wit, agent-based modeling, that has very broad application and which will interface with the other two methods, namely discrete event simulation and system dynamics modeling. The goals of the bootcamp are not to turn everyone in this room into an active model builder. That may happen for some of you. Some of you, inspired by this course, may go off and seek to really immerse yourself in systems modeling, seek to learn a battery of skills that systems modelers apply on a day-to-day basis, and really emerge after the course of much additional study as a virtuoso in systems modeling and health. And I would encourage ambition. I would encourage that. I think that's a great aspiration. And this course could serve as the start of a career that works towards that goal and then applies it very fruitfully, because there's a crying demand for people who can work at that level. But I do not expect that of all, and nor of most people in this room. In fact, probably comparatively few here will go off and seek to form a career in application of this modeling. However, many people in this room, I think probably most, will have the opportunity to work in teams where systems modeling techniques are being applied. You will have the opportunity to serve as a consumer of these models, perhaps in reviewing papers, if you're an academic, perhaps in assessing models built within your organization, perhaps in terms of working in models that have been built by another team member and helping to improve them. And I want to be sure that this course is not a spectator sport. This sort of modeling that we're going to be engaging here will be intensively hands-on. At the least, everyone coming away from this week should be able to take a model, inspect it, have developed some sense of what it's doing, some sense of how it functions, some sense of the assumptions associated with it, some sense of what it outputs and what it needs as far as input, some sense of the outcomes it captures and how it captures those outcomes. More than that, you should be able to run that model. You should be able to add new scenarios to the model, to ask novel what-if questions. You should be able to extend the model in small bits here and there, perhaps adding an additional outcome measure, perhaps changing a certain assumption of the model. And you should be able to sort of parse what it's producing in terms of the in terms of what it suggests about the health of a population that's depicted in that model. So I do want to make sure that people within this course all emerge feeling comfortable with interacting with these models at a basic level, even if they are not going to build them up from scratch. And for many of you, I'd like to work towards developing a really concrete sense of how these models work, a sense of what sort of effort goes into building them, what sort of skills, and what sort of skills you would need to look for if you were to hire someone in your organization to build these sort of models. Okay? So, again, I have no plans to have everyone here become a modeler, but I would like everyone here to be able to work with a modeler and be able to understand the products of modelers. Okay? Now, within the course of the bootcamp, because it is so hands-on, we're going to be making heavy use of online resources. I put up here information on the board, and I'm repeating this because a few other people have come in since, that provides login information to the Wi-Fi network, the CA-GES network. This network will require a username and password, and for these cases, for most people, your first name will serve as your username, your last name will serve as your password, okay? I would like anyone who is here and just arrived to be able to enter this right away to get online, because I'm going to be walking you through some materials that I've put online for this course, and which will be supplemented over the course of the next 4 days.
Excuse me, Nick.
Yes?
A lot of people can't get online yet.
Okay, so Dylan's working on it?
Yeah.
Okay, so what I'm going to do is I'm going to show you, I appreciate you highlighting this fact. What I'm going to do is I will walk you through what's online here, and as soon as Dylan is back with information on what's going on, he'll get people set up, okay? Okay, so the first thing is that I've provided a sort of articulated set of materials divided into a set of categories. There's some background materials on the course, including providing access to the site and where you go for videos, where you're going to be going for new examples as they get posted that we've built during class, etc. There's a schedule we'll be walking through in a few minutes. And then there's some handy references for those who are interested in kind of being able to use this software for some of the examples with greater facility. There's some references that provide you tools for achieving that. But we also have a set of subfolders that will probably serve as ongoing assistance for each day of the course. And I'd like to highlight 3 of them as particularly important. The first is a set of AnyLogic examples. The software we will be using through the next 4 days is a software called AnyLogic, which is notable for several reasons. One is that it's intensively visual. You could sort of look at a model and get an idea of many of the assumptions behind it. Number 2, it provides support for all 3 of the modeling approaches we'll be talking about, to wit, agent-based modeling, system dynamics modeling, and discrete event simulation. Number 3, it provides a very general means of building models that can let you use many, many other resources like statistics libraries, like libraries that will help you export data to R or other tools, and additional libraries that maybe allow you to connect to databases, etc. So within this folder, associated with AnyLogic 7 model, I've placed dozens of models that may be of interest to this particular group. And I would highlight that within this group, we're going to be opening up several models starting in a few minutes once you get online that will walk us through some principles associated with dynamic modeling. I would highlight there's one subfolder, hybrid models, that by itself contains another couple dozen models here. Okay, These models are all provided freely online by myself, and you may wish to avail yourself of them beyond what we cover in course. In the context of the week, we will be building up some of these models. We will be using others of these models, but others you may wish to open up, try exploring. You'll find models covering everything from chronic disease to environmental risk factors, communicable illness, zoonoses, health service delivery components, as well as coupled models that link up several of these. So that's the AnyLogic 7 examples. Those are examples that, with one exception, come out of our group. There's additionally one that is called lecture slides. And these will provide a set of slides, some of which I'll be showing, most of which I will not have a chance to show. I provide a couple dozen sets of lecture slides there, which cover the major topics that I cover in course. In the course of our sessions, most of those will be covered interactively, and I'm going to be relying less on those lecture slides. However, those seeking a systematic introduction may find those lecture slides of help. Okay? So I provided those to you, and you may wish to open them up. You will see me in the course of each day use some lecture slides that I will show, and you will find those within that subfolder. Finally, there's this subfolder, Models Built During Class, which I will be supplementing throughout each successive day with models. As we build models together, I will put my copies of those models in that folder so that you can go and open them. Okay? If you have to step out to take that phone call, if you got lost somewhere along the way and your model isn't quite working, you can always go and open mine. Okay? And sometimes we will build on top of that model for the next step, and you'll want to go get it from there and take it. So those will be folders of particular note. There are two additional folders, step-by-step tutorials, which provide a set of hands-on, very detailed, narrated sort of examples that walk you through use of this software. So they'll have a particular model, sometimes discuss the deliverables from that model, and then in a step-by-step fashion allow you to sort of follow along a series of exercises. This sort of step-by-step tutorial will be the type of skill-building exercise that will help to practice some of these model-building exercises we'll be doing together. With the model-building exercise, we'll have the help of two TAs in following them. But within this context of these tutorials, what you will see is, guidance visually on what to click on and what to expect on a step-by-step basis that may be useful for you back at home after the course is finished or in between sessions, okay, in the evenings. Now, Dylan, is there any progress on the Wi-Fi access?
Slow but surely.
Okay, so it's being worked on?
Yeah, so we're looking into the portal web page problems that people are having. So when you try to log in, it says I can't be found. Looking into that, getting a few more passwords for people who weren't on the original signing list, and looking into why the router is being a little bit unresponsive to some people. So it should come with time.
Okay.
It might take a little bit.
Okay. Okay. So thank you, Dylan, and perhaps this is a good segue to note that within the course of this next 4 days, I'm going to make the contents highly adaptive to the needs that arise. And if we end up having a very strong consensus about how it needs to be changed, or strong requests that come from multiple people about what they'd like to see for this course, I will respond to it. Additionally, constraints like this one. So maybe I'll start by going through a little bit about the schedule, noting that this will evolve. Dwight Eisenhower once said, plans are nothing, planning is everything. And Clausewitz, the famous Prussian strategist, once commented that no plan survives contact with the enemy. You folks are not the enemy, but I've learned that principle applies to courses as well, particularly courses which are as challenging as this one. So this is a schedule that is provisional. It is adaptive. It is designed to evolve in response to needs. But we're going to be starting this morning with okay, this is actually, excuse me, I downloaded the wrong one there. Here's the schedule. Oops, here's the schedule for this course. I'm going to have to update that one. So day one, we're going to be going through a set of models and exploring them interactively. Try running them, seeing what they involve for each of these types of modeling. I'm then going to provide some brief motivations for system science. And if these issues aren't worked out in the next 5 or so minutes, I'll probably just dive into that. Let me ask you here. I'd like to canvass folks because I realize not everyone could respond to the initial survey. How many people here have enough exposure to system science or complex systems methods that they feel that talking about the motivations for it is unnecessary? They don't feel compelled to sort of spend a long time on that. How many people? If you could raise your hand. Okay, great. How many people are comparatively new to this issue of why system science methods might be desirable in health? Okay, just a few. Thank you very much. So I'll keep my remarks especially brief, but I do want to hit a few points because I find that I have the fortune and privilege to teach these methods along with some other leading figures within system science and health area. And I find that the perspective is a little bit different for each particular instructor. So I will provide some motivations for system science with a particular emphasis that I think comes from my side. Each of us comes from different backgrounds. The folks who lead courses in these areas and who are researchers within these areas, and I'll see if I can infuse it with some of the principles and motivations that I find most compelling. Because you may not, if you don't hear them from me, you may not hear them otherwise. Based on our experience last week, I'm also thinking about quickly hitting this issue of talk about statistics and dynamic models. Okay, models come in very many forms. In fact, the term model is highly overloaded. As we know, there's many sorts of models and modeling that have very little to do with the contents of this course. I'm going to be briefly discussing the complementary, each important but different role played by statistical models and dynamic models, briefly, to make sure that those in the course have some appreciation for the different enterprise associated with dynamic models. Okay, dynamic models seek to contribute insights that work together with insights from statistical models, but are different in what they secure in terms of the actionable outcomes of dynamic modeling insights are different from statistical insights. And we'll talk a little bit about that just to situate things, to help people sort of make sense of the cacophony of different models out there and the different models that can play a very important role in health. Now, after lunch today, I am preparing to dive back into hands-on use of these models. And we're going to be systematically covering a set of topics related to these models that at one level are teaching skills using this platform, AnyLogic platform, okay? We're going to be building up a model, learning how to run models, learning how to build models, learning how to change assumptions of models. And that's going to be at a kind of from one lens, from one perspective, that's going to be a major outcome of today. We're going to be getting familiarity with the software so you can use it with increasing facility. However, at the same time, we're going to be emphasizing certain lessons about the nature of dynamic modeling, lessons about what it can do and what its limitations are, lessons about the assumptions that go into models, lessons, in short, that will help you be a better consumer of models and have a couple take-home messages from each exercise. And within this course of this schedule, I've highlighted lessons, sort of take-home messages from each lecture. So if you go through these lectures and you decide, whoa, this is great working with the software, but it's a lot of confusing, it's a cacophony of different things to do in it, and I'm getting lost in the trees, you can always pop up and come back to these high-level lessons, which are absolutely key lessons about the nature of dynamic modeling. And I'll try to go back and emphasize these lessons whilst covering these different topics. So today, we're going to build some basic skills together, okay? Build some skills that tomorrow that are going to serve us tomorrow as a foundation. So having been able to build up populations that exhibit heterogeneity, that have different types of processes represented in each individual, processes that relate to different concerns. Perhaps it's progression of diabetes on the one hand, and changes in weight and weight of an individual and weight categories of an individual on the other. Having that in hand, in day 2, we're going to be tying this together with representations of service processes. These service processes may be associated with presentation of an individual for care in a health system. Perhaps it's going to seek an appointment with a primary care physician. Perhaps it's presenting for emergency care. Perhaps it's elective surgery. We're going to be tying together the sorts of models that we're building today with these sort of service processes. How you represent service processes, which bring up a set of different considerations. They have considerations that, well, in Canada and in Australia, but in many areas of the world as well, resources are of central interest, and limited resources. You only have so many MRIs. You only have so many operating theaters. You only have so many emergency room physicians or nurses. Only so many nurses who can help with suturing for emergency patients. And we're going to be representing these services and recognizing how this tool of so-called discrete event simulation can help us represent these resource-constrained processes. So this is called discrete event simulation, and we're going to be diving into that tomorrow morning. And then tomorrow afternoon, in lessons that apply to both these sorts of modeling, we're going to be talking about how to capture events within the modeling that might be associated with reporting, that might be associated with immigration, or other factors, perhaps even fertility, things that go over the course of life, and how to capture dynamic populations which are not merely following a cohort, but where people come in, there's mortality, there's births, there's immigration, etc. In day 3, I'm planning to do a deep dive on a topic that many people find very enlivening, and that some of you, particularly those interested in issues of obesity and the obesity epidemic, may find quite of interest, which has to do with GIS integration. linking these models in with the very rich data we have available for us through geographical information systems. How do we capture the spatial context of agents? How do we situate them within neighborhoods? How do we have their characteristics, their behavior reflect the nature of the built environments in which they're nested? How do we have it reflect the nature of the food environment in which they exist? So we're going to build up in a set of stages models where these agents move about, exhibit mobility along road networks or bike paths or walking networks between different resources. And we're going to capture the impact of the built environment and aspects of the food environment on the weight status of that population within those environments. Okay? So here we're going to be using GIS databases for Melbourne, linking in with them, and having the agents move accordingly. Okay? So that's the plan for day 3 right now. And we're going to, additionally, and this is a very important point we will be getting to, we're going to have agents interacting via social networks, interacting through one of the many types of networks in which they can be nested. And we'll see there's several ways that they can interact through the networks, through a mechanism called messages, or through other means of social network interaction, such as by affecting trajectories, the flows associated with representing their weight. Now, day 4, the topics will likely undergo a lot of evolution as people's interests come out and based on the progress in the previous 3 days. We have a number of topics that I'd like to cover. The 2 ones I'd like to try to capture have to do with hybrid modeling, this whole enterprise of weaving together multiple model types, weaving together these types that make it extremely easy to represent service-related factors, together with these agent-based models that represent GIS context and multiple comorbidities so well. Or models where most of the population is represented in a very aggregate, rough and ready way, and then some focal group of an at-risk or high-risk population is represented in a very detailed way. So hybrid models, we're going to take a look at 5 notable types of hybrid models. I'd also like to talk about what I think will be one of the defining trends in systems science, in complex systems modeling and health over the next decade. And I say that because I'm at the nexus of these 2 areas, systems science on the one hand and health, and big data on the other. We are no longer practicing our parent system science. Roots of system science techniques go back decades. And indeed, many of the formalisms we'll be seeing, whether it's discrete event simulation or system dynamics modeling, have been around for the better part of half a century. For actually half a century, not just the better part of it. But what we can do with these models is increasingly shaped by, increasingly enabled by the emergence of, call it what name you will, the hype name is big data, a more sort of sober name is data science, emergence of data science, the availability of electronically sourced data. I'm extremely excited about this. I believe it is central to the enterprise over the next 10 years of system science and health. And I believe over the course of the time you folks will be building models, it will increasingly impact what we can do with these models. And platforms like AnyLogic are seeking to position themselves to better take into account this move towards big data. So I'm going to be sharing with you why I think it's so important, what it can accomplish with our models, and increasingly the ways in which models are brought together with aspects of big data. Following lunch, we will have a buffet of different possible topics that I will be seeking some guidance from you on what will be of greatest priority. Many of these topics, nay, all of these topics, except save one, are topics where you'll find videos of me online talking about it. I have somewhere between 1,000 and 1,500 videos online where I'll be talking about aspects of dynamic model calibration for health. I'll be talking about stochastics and parameter variation. I'll be talking about hierarchical models, models which capture a situated agent in, say, a school, in a neighborhood, in a city, in a region, and capture those nested levels of context. But sometimes these are of keen interest to students, and I'd like to roll them out for questions. There's also this topic of how to capture interventions and how to capture aspects of implementation science, which is of a lot of interest in many of my events. People are wondering, how do we, in a model, capture these translational and implementational challenges to understand, challenges associated with scale up, challenges associated with intervention rollout in the human resource or cost side, challenges associated with financial sustainability of implementation of interventions. How do we capture those in a model? And I could do a module on that. That's not one that's currently recorded. I've delivered it to UCLA previously, but it wasn't on a recorded session. And then finally, there's a set of best practices that I could talk about before I'll do a final set of wrap-up where I give some resources. So this is the plan for the tentative plan for the week. I'd like to get a sense from people here of a few priorities, okay? This is going to shape in a very material way how I go about teaching the next few days. So I'd ask you to take these questions with some gravity. So the first question is, I'd like to get a show of hands here as to how many people predominantly see their role here for this week as being one of kind of appreciating how these models are used, where they fit into the to the health science toolbox, how they work together with other techniques, giving some sense of what they can do and what they can't do, what's hard and what's easy with them, but not so much diving into details of building a model. How many people would characterize their interest predominantly at that level? Okay, great. How many people are, by contrast, really interested in diving in and actually building up a set of models, trying it out not because you think that you'll necessarily become a modeler, but you want to experience what goes into building a model, what sort of skills are needed for it, what sort of level of and types of challenges come up. How many would characterize themselves as being interested in that very, very sort of hands-on, step-by-step building up things? Okay. And for those who haven't raised their hand for either one, could you help me understand a little bit what you're seeking to take away from the week? Anyone? Yeah.
I suppose I'm looking at alternative approaches. I've done modeling in R for the last couple of years.
Great.
Currently use. I'd like to learn another technique, and also most of what I've done has been self-taught, so I don't have any sort of formal training in it. So I think it'd be useful for me to consolidate some of what I've done in a more formal way.
Great. Okay. That's very helpful. I'm a big R user. We're a big R shop. We use R intensively together with AnyLogic. And I've written a very large amount of R code. And I would be happy to work with you to try to make sure that your questions are addressed. Anyone else want to speak up about what they're hoping? If you don't feel it was captured in my kind of two broad brush characterizations, anything else you'd like to sort of put forward about a take home you're hoping to get from this week? No? Okay, if you have ideas, if you're feeling a little bit like you have some inchoate sense that it doesn't fall into either of my categories, and you'd like to bring it up later, I'd welcome that. As I say, the schedule will be adapted per the interest expressed into our progress. Okay. Now, Dylan, could you fill us in on the progress with the network?
Well, I'll do that in a second. I think one other thing I might want to add to your list is that from the smatterings of conversations I've had this morning, I get the feeling a lot of people are interested in seeing how this could be used to answer research questions or investigate research topics. So if you can touch on that a couple times during the week, I think that might be very helpful for some clients.
Sure. I mean, it has to do with the lessons, many of these lessons here, but the lessons do emphasize principles, and some of the roles about how they fit into research questions are sort of subtext for them. For example, models allow for examining of counterfactuals. That unpacks into very specific questions about interventions and their possible impacts on different health and cost and other outcomes. So thanks. That's helpful. Dylan, could you give an update on the progress of the network pathologies?
Yeah. So what we have for the network is we're on CA.
Indeed.
And we had an old list of the participants. Now we have a full list of everyone. So everyone who's here should be able to log in for the most part using your first name as your username and your last name as your password. However, there are a few people that need to do the opposite just because there was somebody else by the same name already on the network. So, if you are Steve McCarr, Steve Allender, Melanie Nichols, Andrew Brown, Andrew Dalton, Melanie Anderson, or Steve Bowie, you need to use your last name as your username and your first name as your password. Everybody else can use your first name as your username, all lowercase, and your last name as your password, all lowercase. And if you're having any troubles getting on, let me know and I can come around one by one.
Yeah. So thanks very much. So you resolved the issue with the proxy server?
Not quite. They're working on that. IT is absent from their lines, whatever happens to be going on there. So dealing with it in a bit of an ad hoc way as best we can.
Okay, but everyone should be able to log in.
In principle, everyone should be able to get on.
Okay. So that sounds good. This will be my suggestion, ladies and gentlemen. My suggestion is why don't we take a brief health break now? And I understand the men's room is out by the elevators. Can anyone comment on where the women's room is? Opposite that? Okay, also by the elevators then? And Dylan will help people get online, and I'll get an update coming back, and based on that update, we'll either dive into a first lecture or we'll dive into a set of models, okay? And I would note that Dylan has also placed a URL up here, a web link, which once you get online, I'd like you to enter into a browser. There's a dash between the 11 and 2015. That is a dash, not an underbar. So it's not a, it's a dash that's a hyphen rather than an underbar. Okay. So if you could try entering that and let Dylan know of any trouble. Annie is also here to help, I think. All right. So you're welcome to try to help people get online as well. Okay. Okay. So let's take just a 5-minute break while people get online, and we'll dive into the first set of topics.